lot of times we get a question, what is this pain in my neck all about? And it's really kind of a very simple procedure to figure out what's causing it, but there's a lot of different things that go into it. Pain is defined by Webster's dictionary as a distressing sensation in a particular part of your body. Most likely that pain in your neck started out a while back. It started out as just some stress that led to some muscle tightness. Maybe some postural changes, how long you sat at your computer, or how you were sitting when you were sitting watching TV or at the movies, or how you were bent over working on some things in the garden. But those postural things and that stress gradually end up creating some muscle tightness, and those muscles gradually get shorter. And that shortness ends up creating increased pressure in through the spine, in through the vertebrae, the bones in your neck. What'll happen then is that then you go to start to do something, you're exercising or you're reaching into a cabinet or whatever it might be, and that tension, that tightness that's developed here, that's running from your shoulder up into your neck along the line of those muscles, that tightness starts to pull everything closer together. And so then any kind of repetitive activity like emptying the dishwasher or carrying some groceries or carrying the basket of laundry back upstairs to fold it, etc., those things, those muscles are already short and they're put under this tension, and it makes them get shorter. And so that muscle that has to repetitively stretch, at some point in time it starts to not be able to stretch as much as it needs to, and so it starts to get tight. Well, that tightness is what forms, those knots that you think about, right? You got those knots that are right here, you got that knot that's over here, and those knots keep the muscle from being able to stretch out, but also those knots start to create that tightness or that tension that puts pressure on things. In the beginning, it affects you because your neck is just stiff. It's a little bit tight, it's a little bit achy, it's a little bit sore. No big deal, and we usually just kind of go on, and it lasts for a couple of minutes, it might last for a day, and it's gone, and then maybe it's back a week or two later, or a month or two later, etc. Sometimes that will progress into a headache, and so those muscles all attach, as you see on the picture, they all attach to the base of your skull, and then they run down your spine. Well, when those muscles get tight, whether it's because of stress or the pressure or the pinching on the nerve, etc., they'll create a pull, and they pull down on the base of your skull. That is what creates all headaches. And so that headache is a warning sign that things are getting a little bit worse. That starts to progress into, I can't turn my head, I can't turn to see when I'm driving or changing lanes, I can't look up towards the ceiling or up into a cabinet, because the space in between the vertebrae has gotten less. There's less room for those bones in your neck to move, and what will start to happen is it gives you that lack of mobility. As it progresses and it gets worse, it starts to turn into this pain that potentially radiates down your arm, into your hand, or it might radiate down to your shoulder blade, or it might radiate into your chest, because what's starting to happen is you're starting to get pressure not only on the bones, but now the pressure has also increased onto the disc and onto the nerve. And that's a sign that the problem is obviously getting worse, but that pressure onto the nerve is what's going to give you the more intense pain, etc. The pressure on the nerve would be kind of like putting pressure onto a garden hose. The water's flowing out, and all of a sudden you put that pressure onto the nerve, there's less water coming out the other end. If you have any of those more advanced symptoms of radiating symptoms, or that crick in your neck, or the pain that's in the neck, more than just a stiffness and a soreness, that's your number one sign that something's not right, and you've really got to get some things checked out, and we can help you with that and check that out really easily and help you to get on the course to feeling better. Now, the typical way that in society we're kind of taught to deal with this pain is we'll take some medication, Advil, Aleve, ibuprofen, whatever it might be, or go to the doctor, get a pain pill and take that. And there are times where, as a physical therapist, we feel that that really is what's needed. But what it does is it masks your symptoms, it changes your symptoms, it decreases the pain, it doesn't change the cause of the pain. The number one thing is we're going to be able to really assess and figure out what is causing those symptoms that you're having. More importantly, stop it in its tracks, keep it from progressing and getting worse. The second thing is that in most cases, it's gotten to a point where we need to do some manual things, some manual therapy to try to increase that space in between the vertebrae. Get the vertebrae further apart so that they stop pinching against each other. Get the pressure off of the disc and off of the nerve so that the symptoms come. Manually, passively stretch those muscles in your neck so that they are truly longer. Muscle is like a rubber band, and the longer that it is, the less pressure there's going to be. So even if you're just feeling some tightness and stiffness in your neck, there are manual therapy things that physical therapy here at Loudoun Sports Therapy Center can help you with. We'll get those muscles longer, we'll get all that pressure off and keep the problem from progressing. And then the final thing would be working on strengthening all of the muscles that run from the base of your skull all the way down your spine to about mid-back, and getting those muscles to be stronger so that they hold your head. Get you specifically strengthening them will really help everything in your neck to be more conditioned and stronger so that that pressure doesn't develop. Here at Loudoun Sports Therapy Center, we can get you in, we can figure out what's going on, we can develop a treatment plan specific for you. So if that's the case, or if you're having any further symptoms of the radiating pain, real sharp pain, that crick in the neck feeling, that pinching, give us a call, click on the link below, we'll get you in, we'll get it figured out, we'll get you taken care of, and we will keep this from turning into a much bigger problem.